And then you're going to look at this. There you go. They are all good.
Okay. Waiting to see it on here. Hi, everybody. It's Dr. Linda from the Vascular Birthmarks Foundation. Sorry, apologizing for a little technical difficulty this month. We're going to blame it on the weather. But I'm getting my phone situated so that I can see the questions come in. But in the meantime, everybody, please welcome Dr. Gregory Levitin, world-renowned vascular anomalies expert from New York City and also his practice in California. Thank you for joining us this month, Dr. Levitin. And how's everything with COVID in New York City going?
Oh, well, thank you, Linda. I mean, first, it's a pleasure to be back, and thank you for inviting me. And, fortunately in New York, we kind of learned a lot of hard lessons last year. And so COVID is still here, so everyone takes their precautions. Our vaccine rollout has been mostly successful, particularly in Manhattan, and working our way into the boroughs. And so our fingers are crossed like everywhere else around the country.
Great. And the most important question is, all of your wonderful patients and fans on the West Coast want to know, when are you going to be back in California?
Yeah, so I got back about a week ago, and I'll be back out I think June 10th or June 11th. So in about 6 weeks. Yeah.
So I'm sure all your fans will be happy to hear that. Corinne is saying, hello, Dr. Levitin. She's in sunny Seattle at 70 degrees. Don't rub it in. Don't rub it in, because we're on a
long day to rub it in.
So Rita is on. She's saying hi. Megan Barker is on. We are ready to take your questions for Dr. Levitin, and any questions on diagnosis and management of what we call VBARs, vascular birthmarks, anomalies, and related syndromes. We're trying to coin that phrase so it's all encompassing, because a lot of people say, we don't have a birthmark, we don't have an anomaly, we have a syndrome. So we're using that term VBARs. Hello, Elma. Hi, Ekaterina. She's watching us probably from Poland or Russia. Sandy's on, Drury's on, Hugo's on, Drury from Virginia. So hi, everybody. We're ready to take your questions. We do have to leave at 6 p.m. promptly because I have a VBF call at that time. So sorry, we had a little technical difficulty getting started. Don't blame it on us, blame it on Facebook.
Blame it on the rain.
Right. So while we're waiting for the questions, Dr. Levitin, have you observed any impact from your families not being able to get to you during COVID?
Yeah, well, as a physician based in New York City, it was extremely difficult at the beginning. And if we go back just literally a year ago, my office had just closed, and it was actually, we closed within days of, mid to late March without a plan in place. And so phone calls were not being answered. Emails to offices were just, going into, full inboxes, because we had not yet figured out how to work from home and things like that. The best part for me is, my practice is online. I have a website, I have patients that were able to reach out to me. So I was able to make contact, but there was a lack of information, and that was frustrating for everybody. And, coming, here we are a year later, and I'd say for the last 3 months, I'd say not business as usual, but we are able to meet the needs of our patients, without any unnecessary delays or anything like that. So I encourage anyone who had a delay in their treatment, who may have been frustrated or felt, shut out, reach back out to your physicians. We all learned a lot in 2020, but we have, good practices. We have safe environments. We do COVID testing for all of our patients at the hospital. I want patients to feel safe and also available to come in and get their treatment.
Great advice. So Andrea Thompson writes from Nova Scotia, her 6-week-old daughter started treatment for her segmental hemangioma this morning. We have already seen improvements.
Yes, I love stories like that. And what I think they're talking about is they just started their propranolol or hemangiol therapy.
Right.
And the most important thing about hemangiol is there's a critical amount that you will see a change in the hemangioma that one might not have seen prior. And what do I mean by that? Well, we step up our therapy from 1 to 2 all the way up to 3 milligrams per kilogram per day. And we do that just to not only educate the parents on how to give a medication twice a day, but also for the precautions for blood pressure, heart rate, or blood sugar monitoring. And while we don't do specific monitoring at home, I find a significant number of patients who who had kind of like a modest, if any, improvement on 1 or 2 milligrams per kilogram per day. When we hit that 3 milligram mark, dramatic changes happen. Specifically, you said something at the beginning, a segmental hemangioma. By far, those are the cases that we say are home runs. Those are the patients we expect to do the best on oral therapy.
That's great. Thank you for that. Drury Welford writes and says, my 26-year-old daughter has a VM on the right side of her face. In her childhood, we were never able to find any treatment. Now she is thinking about going to a doctor who does surgery and may include a facelift. Do you know anything about this? That's right up your alley.
Yeah. So, venous malformations are certainly one of my favorite diagnoses because there's really nowadays, there's just so much we can do. We have 2 types of YAG lasers, one for the inside of the cheek, one for the outside of the skin, that's very safe, very effective to not only shrink tissue, but remove the color, give people a sense of a normal appearance. And for the types of malformations, venous malformations that occur within the face or the muscle, or even the buccal fat space, there's lots of surgical operations that can debulk this safely, preserving the facial nerve, which is by far the most important aspect of these facial malformations. And I highly encourage them to get an MRI and a good evaluation, and they should really be able to find a specialist who can help them, who's treated this before.
And speaking of which, you've always been wonderful with VBF families answering their emails, and families can reach you. And which email do you prefer that they use? Because we have you at birthmark.org/Dr. Levitin, but
Yep.
do you also prefer, what is your email? Is it?
So it's Dr. Levitin at birthmarkcare.com. And so I have consolidated all my emails into that one account. So whether you go to the birthmark.org website or my website or any of the, the parents forums, that should be the main email that comes to me. And that's because I have a dedicated, inbox for just patient inquiries. And, to the family with a venous malformation, if you want to send me a photo and ask my opinion, I'm happy to give you an opinion. I'd say, maybe, not every patient who emails me comes to see me, but I think it's important for them to get an opinion and make sure that they feel like the doctor they may be seeing somewhere else in the country or in the world is also able to give them accurate information.
So the other thing before I read the next one is Dr. Levitin will be at our super clinic on October 9th, Saturday in New York City at Dr. Geronimus's office. He will be on the team with Dr. Coletti. So he and Dr. Coletti will be together, and they will be seeing patients all day long, and you'll actually be getting a free, amazing consult. So it's at birthmark.org/conference. Keep that in mind. Registration is now open. Bobby Webb Fisher says, I talked to you about my son Brett and sent you pics. He had the huge hemangioma removed from his knee in February. They're in North Carolina, 2 wonderful doctors, vascular and plastic orthopedic, work together. He's done wonderful so far, just got his 2nd skin graft Tuesday. So I'm not sure if you remember the case.
It's a vague memory, but again, it sounds like they got good specialists who had good surgical practice to remove a very large or bulky lesion. And for skin grafting, the most important thing is immobilization. And skin grafts are used when we cannot borrow or stretch the normal tissues to bring them back together. So I wish them a lot of luck, and also send me an update. I'd love to see, even when they're not my cases, I'd love to see how these children progress and get back to normal.
We learn from all of them, don't we?
Indeed we do. And like I said, I share as much as I learn from others.
So Melissa McAvoy writes and says, hi, Dr. Levitin. Are we at a higher risk of blood clots from vaccine? I have a very large port wine stain.
Yeah, fortunately, for the most part, vascular malformations and vaccines have not been shown, or any evidence of vascular dysplasias, to have increased incidence of blood clots. The one condition, Klippel-Trenaunay syndrome, is probably the one condition who has higher risk of blood clots in general that we might put an asterisk by their names. But I know with the recent news reports of AstraZeneca and Johnson & Johnson vaccines, these were actually cerebral blood clots, an unusual location for a blood clot caused by platelet consumption. And the platelet consumption is an idiopathic or autoimmune condition that's very, very rare to begin with. And it's still not quite sure if this is even related, because, a few of these happen every year. And when we're vaccinating millions, literally millions upon millions of people, we have to start correlating whether or not some of these things that happen anyway could potentially be related. But specifically, if you or a family member have a vascular malformation or birthmark, other than KTS, I do not think that they are at increased risk.
Thank you. We have a nice kudo from Barney Abramson. He says, Dr. Levitin is an angel and VBF is the best thing that ever happened to us. You all do great work.
Tell Barney he owes me an updated photo of his lovely daughter.
Well, he's listening to you right now. So
good. I saw him at one of the VBF conferences last time with a big heart on their daughter's cheek. So I can only imagine how old she is now.
And yes, we thank you for the reminder. Remember, May 15th is the International Day of Awareness for VBF. So don't forget to put on your birthmark, that red heart on the face. We keep showing your picture with your twins. So this year we'll have to get a updated one with the twins and Cora and yourself, Dr. Levitin, so we can share.
We call Cora our Queen of Hearts here. So we'll definitely.
Oh, I love that. So Denisa Ayer says, hello, doctor from Charleston. Do you have any experience treating with the new Prima in young children for port wine stain?
Yeah, so I have not yet used the Prima. And I think Dr. Geronimus may be the only doctor in New York City that has started with the Prima. I think it's the newest and greatest, but it still uses the same wavelength as our Perfecta. So it remains to be seen if there's anything more effective than the traditional pulse dye laser that all of us are comfortable with. But again, it's a new laser. I'm sure there'll be new studies or comparisons made, but stay tuned to VBF. I'm sure you'll be the first to report that.
Thank you for that. Elma Fleming says, any experience with stubborn airway hemangiomas? We've had 2 failed weaning attempts with propranolol. My daughter is back on propranolol.
Quickly, how old is the daughter?
3 years old. She's 3 years old.
Yeah.
She has face syndrome, and they're still trying to wean her. And again, she could come to our conference, but this is her concern.
Yeah, there's probably 3 separate issues on this that are too complicated for a Q&A like this. I would actually encourage them to reach out to me directly. I need some more clinical information and maybe even share some x-rays to kind of get a better sense of that. But between myself and one of my pediatric airway experts, we can certainly offer some advice wherever. I'm sure that it must be, sometimes it's difficult for these children who are trait dependent to travel. So I'd be glad to give them some advice offline.
Thank you for that. And again, I know Corinne's probably posted Dr. Levitin's email in the string here. You can find it. You can also get him at birthmark.org/Dr. Levitin as one of our VBF international experts. The next question, hello from 80. Diane and Verda says, hi from New Zealand. I have a vascular malformation on my knee. It is in soft tissue and is intra-articular. What treatment would you suggest in these cases? What type of doctor do I need to see?
So essentially an interventional radiologist who focuses on the body is one of the doctors you need to see. An orthopedic specialist is another doctor you need to see. And me, if you can, feel free to send me a copy of your MRI. And these type of joint malformations are very difficult because if you sclerose the joint, you can actually get scarring and fusion. If there's soft tissue or any other types of areas around the knee or the joint itself, sometimes tissue debulking alone is sufficient. It really depends, again, what the problem is, whether it's painful or just bulky. And again, a picture tells the whole story. So they, again, can feel free to reach out to me offline. I'll be glad to review their photos, their MRIs, and offer them some advice.
Thank you very much for that. Fiona says, I am a 42-year-old woman. I've had 37 laser treatments and some excisions to my port wine as it was cobbling. Throughout life, it's been changing. I'm now on maintenance, but I suspect other stuff is going on as I have chronic pain syndrome and migraines. Dr. Linda has kindly suggested I have an MRI and clear for glaucoma.
Right. So I assume this is a facial port wine stain. A lot of these occur in what's called the V1 or the upper eyebrow and forehead area. It can also go down into the V2 mid-face area. And it can, and again, we talk about Sturge-Weber syndrome, which can mean that the malformation not only is in the skin, but it goes directly into the meninges overlying the brain. And we're looking for any types of vascular malformations that could potentially affect the eye, which causes pressure called glaucoma. If there's any seizure activity or history like that. But specifically about the overlying skin and cobblestones, if there's any type of skin changes, she's welcome to send some photos. It sounds like, someone's been treating her very effectively for, many years. And unfortunately, for about 15 or 20% of port wine stains, not only do they darken over time, but they can thicken over time. And they do need tissue debulking to restore this back to normal.
And you'll be happy to look at her pictures, right? And give her an opinion.
Email me anytime.
Yep. Joanne DeMarco says hi. There's a lot of patients that are chiming in to say hi that have been with you for many years, and VBF as well. Oh, and Bobby said, yes, she will be 23 years old. And wow, we have hi from Mexico, hi from New Zealand. And that's Fiona's. Oh, she said it's on her face and borders on her eye, but you already addressed the V1, V2. So thank you for that. Lots of people just shouting out and saying hi. Lots of people are watching. Hi, Tam Bam. Hi, Sandy, Samantha, Alma, Krista. We got a question from Omar. I can't find info on port wine in my face treatment in adults. Any idea?
Sure. So, the thing is, a lot of times people who are adults with port wine stains grew up in an environment where the laser was not as popular or available. And so for 15 or 20 years, they did not know that treatment was available because they had, in their local communities, they didn't have it. The pulsed laser is by far the most common and effective laser for port wine stains. So I'm not sure where Omar lives, but if he were to find either a dermatologist or birthmark specialist who has the pulsed laser, it's never too late to start treatment. The benefit of laser treatment is when we start at an earlier age, we can oftentimes reverse those changes before they gradually darken. Port wine stains, like all types of malformations, are slowly progressive over time. They get darker over time, also during sometimes growth spurts or even just with sun exposure. But again, the pulse laser can treat this, reverse this, and stabilize this from further progression.
Thank you. And again, Dr. Levitin will be with our team of 14 other doctors on Saturday, October 9th at Dr. Geronimus's medical building on 34th Street in New York City for our Vascular Birthmarks conference. You can get a free consult and free laser treatment. So we did 47 free laser treatments the last time. We're going to break that this year. So if you do need a laser treatment, sign up and you'll be able to get a free one. Kristen Birch says, so glad I found this foundation so close to home, Greenwich, New York, eagerly awaiting to hear from Dr. Levitin on when he can do my son Landon's surgery for his eyelid hemangioma.
Yes, so certainly, I am absolutely happy to do that. I'm sorry, can you still see me? Something came through.
Yeah.
Oh, good.
Yeah, we can see you perfect.
Oh, good. I'm happy to do Landon's. This is an insurance issue that is being dealt with right now. And I know we've shared 2 emails already. So we are waiting for a response from our last submission, and I hopefully do that soon.
And this is another very important point. There aren't a lot of doctors that accept insurance to the extent that Dr. Levitin does. And this is why we, refer quite a few families to him, because we just do not support that families have to pay for out of pocket. We're currently working with a lobby firm from Chicago on federal legislation that will mandate that insurance companies cover treatment. Dr. Levitin will be consulted with through these lobbyists over the next few months to provide the evidence that we state that, you know, these cases are being denied by insurance, and we just don't want parents having to sell their cars, their homes, or cash in their children's education funds to pay for surgery that should be covered by insurance.
That's a
So
great point, Linda. And I think, you know, one of the things that, I mean, and it happens every day, you know, someone who meets me with, who often is an adult or as a child, we all want a cosmetic result. We all want to have, you know, the malformation removed or look better or improve it. But these are congenital. You know, people were born with this. This is not something that they want to alter the shape of their nose, or maybe they had fallen down and broke their nose and wants to have it fixed. These are, you know, things that are absolutely, you know, should be covered by insurance. They're considered reconstructive procedures. They fall under plastic and reconstructive surgery, but again, are not cosmetic procedures. And, you know, I personally accept 32 insurances, and I'll say I'm 99.9% effective on getting insurances to cover. Every now and then we have a limit, you know, someone from New Jersey who can't cross the river and come into New York, but we can even then reach back out. It may take a little bit longer in some cases. But I highly encourage anyone who's seeking out treatment, you know, anywhere, to keep looking for physicians who are in network and able to accept your insurance, because you know, even if a doctor charges you $0, the hospitals will not do the same. It can be very expensive, and it's definitely worth, you know, like I said, reaching out to another doctor to see if they are in network. We have lots of birthmark specialists on the birthmark.org website. And you know, I personally have lots of patients who travel in to see me just for their treatment because we do accept their insurance.
thank you, very important. Esther wants to know, does a port wine stain get darker even if it started out light prior to treatment?
So the short answer, and unfortunately, is yes. You know, as I tell patients with port wine stains, we have these, you know, these opportunities to treat children at the earliest age possible, you know, in the first weeks and months of life. But also doing nothing carries some small risk of progression, because port wine stains are vascular malformations, which means you're born with it and you'll die with it. And over time, through growth phases, hormonal changes, time, and sun exposure, port wine stains traditionally dilate their vessels, get darker, and in some cases can even thicken the overlying tissues. So we think of this as not only is it treatment, but it's also preventative treatment. And so if you see any signs of progression, which is a darkening or thickening of the skin, that's the indication to come back in for treatment.
Thank you. So Esther Anseline raises a really good question that we hear a lot about. She's heard about Mickey Mods and the topical Rapamune creams, and wants to know if you know anything about them used before or after a laser treatment. I know Dr. Nelson and Geronimus in the past did studies that said they didn't really see a difference, but some doctors say they do. I don't know. What's your take on it?
So, you know, the very first studies that Dr. Nelson presented at actually the VBF conference, you know, several years ago, showed promise. And I think that that's kind of the status that I still say. I haven't given up hope myself, but it has not been brought into my, you know, to my therapies yet until it's been better studied and seen how effective it can be. I think immunomodulators or any type of these medications that we are really just now exploring and discovering should not be used on anyone under age 18, number one. And number two, we're still learning. And so I think that these are things that are hopeful for families with port wine stains, that yes, in our lifetime, perhaps we will have a better treatment out there. But I don't feel that it's been standardized, or it's certainly not considered the standard of care at this time.
Thank you. Vicky has a great question. Vicky is 71 years young. She has a port wine birthmark on her face and it's getting darker. She said it's impossible to cover it with makeup. So first part is she wants to know, why is this happening and will it get worse as I get older? And then maybe you could address treatment and that at any age it's still effective.
Sure. So for a young woman of 71, there's a very good chance that we're talking about the next 25 or even 30 years. I mean, this literally, you know, nowadays, you know, because of our better healthcare, we're actually living longer. Over time, living longer does mean that the port wine stain can darken and thicken over time. It's never too late to start treatment. And obviously, the lighter it is, the more easy it is to treat. But the darker it is doesn't mean it can't be treated, it just takes more treatments. The laser that we are talking about is the pulse dye laser. And for those people who are not familiar, it's not an eraser where you just kind of, laser and it goes away. It lightens it. It gets absorbed in the dilated vessels within the capillary malformation of the port wine stain, but it takes several treatment cycles to treat this effectively. The only other thing I'll mention to someone of a certain age, like 71, is who may or may not be interested in aggressive laser treatment, is there are other types of makeup, both called, the Hollywood, types of makeup that are high, definition makeups that are now used in the industry, as well as microskin, which has been around for several years, and also is a way to cover the skin with a type of makeup that's breathable and washable, meaning it doesn't wear off, but it does have to be reapplied. In this day and age, a lot of people are also embracing their port wine stains. At 71, she's lived a long enough life where I'm sure that's part of her identity and who she is, but never means that it's never too late to want to make it look better or overall lighter than what it used to be. I don't think that anyone could ever promise 100% guarantee of anything that these types of port wine stains could be removed entirely. In fact, when we do laser, it's not 100% guaranteed to go away, but we can make it 50% lighter or even more than that when we start early.
And again, the invitation stands to every one of you. Register at birthmark.org/conference, and you could get a free laser treatment by Dr. Geronimus, who's like one of the top in the world. He's using the Prima laser for the free laser treatments. And you could even get a test spot done if you just want to get a small spot done, or if you want to get the whole thing lasered. He will be using topical numbing cream and or some nerve blocks, but no general anesthesia, but still free treatment. And then Esther asked another question, and I think this is another good one. She wants to know if it's normal to bruise and scab after laser, and that second part is purpura always necessary to mean the treatment is working?
Sure, those are great questions, and thank you for bringing that up so we can give that information to everyone. So the pulsed laser, like I said, gets absorbed by the dilated vessels. It clots those vessels and does turn purpura or purplish color for 7 to 10 days while the body scavenges and washes that away. You do need to see that purpura in order to get the desired effect. If you use too low of a setting and do not see a good reaction, then there really means that the clot did not take and those blood vessels washed through or stayed dilated or patent. And as far as crusting is concerned, we have, all of us who treat patients with laser have our preferred settings to try to minimize the risk of any injury to the overlying skin. And the laser itself has a coolant spray that protects the skin. But even even when we treat patients with 200 or 300 spots, 1 or 2 spots may get a blister or a scab afterwards. It's not a dangerous thing. It's just a superficial blister that should be treated with ointment for 3 to 5 days until it heals over. And for the most part, you can't even tell afterwards. You can treat with too high of a setting and cause a burn and a scar. So you do want to be careful, particularly in children under 3 to 6 months of age. That's when we typically worry about that type of treatment on port wine stains and hemangiomas. But for adult skin and of good integrity, again, we know we're not going to get it all in one treatment, so we don't have to turn it all the way up to the highest level. We can work our way up to that level to ensure a safe treatment, and patients should not have to worry about the risk of scarring for these type of things.
Thank you for that. And a sneak peek is Dr. Nelson will be doing Facebook Live with me next month, live from California. And he's got some exciting news about a secret research project that's going to improve the treatment of port wine stains. So nobody knows about it. Come back next month and you're going to be the first to hear. So even you too, Dr. Levitin, tune in and you'll hear about his exciting research and the promise that it holds for our families affected by port wines. Ariana Juarez Ramirez says, hello, doctor. My son Mateo suffers from lymphangioma on the face and neck. He is currently taking sirolimus. He has been taking this medicine for 5 years. Is there a limit of years to stop taking it? We are from Mexico and Mateo is being treated at the Cincinnati Children's Hospital.
So first of all, sirolimus is a type of medical therapy. It's a type of medicine that can reduce the immune response. So children who take it are at slightly increased risk for infections and needs to be taken under the guidance of a medical professional who's able to watch over them for that. Now, sirolimus for lymphatic malformations can shrink the tissue, particularly microcystic or difficult to treat malformations, and it can stabilize them or even sometimes shrink them. So there's definitely a role for sirolimus in the management or the medical management of vascular malformations, particularly lymphatic malformations. But as far as a certain amount of time, I have not read anything that says that a patient should not be, should be treated after a certain amount of time to cut them off. It just comes with the same added warning that, especially during respiratory flu seasons, that they may be at greater risk for catching infections. But typically, you also want to have an objective evaluation and make sure that you're seeing the desired effect. Not all medications work 100% effectively. So you want to make sure that you're seeing that there's a good response or preventative of progression or potentially even avoiding the need for surgery for those patients that stay on that medication.
Thank you. Christina asks a great question. We get this a lot. Is it normal for a port wine stain to be drier where the stain is than the rest of the skin? And is there any special care I should be providing where he has the port wine stain?
So that's a great question as well. And I think this really comes down to an individualized case by case basis. In some cases, absolutely, a port wine stain with increased vascularity can have flaking on the skin. And for some patients, quite the opposite, it doesn't have any signs of those change. I think when the port wine stain becomes thicker, that's a different situation, or with cobblestoning and where you do get exfoliation or flaking of the skin. But there's no harm in treating the port wine skin with moisturizers, Aquaphor, or lotions, any more so than your normal skin. Sometimes you can have sebaceous gland hyperplasia, which means that it may be more prone to blackheads or acne or things like that, if depending on mid-face cheek areas. But if you're any concern at all, a good dermatologist, or again, email me some photos and show it to me. This doesn't sound like anything significant, but it should be easily treated with topical remedies.
Thank you for that. Nikki wants to know, says her daughter has a patchy port wine stain on her upper right arm, and that arm is around 3 centimeters larger than her other arm. Is this likely to be KTS? She also has a hemangioma on her opposite arm and epilepsy.
Wow. That probably is a better question to ask me offline, because I'll probably have 3 or 4 follow-up questions. But I'll just say, from what you described, let's talk about KTS. What is KTS? KTS is a mixed malformation that characteristically has, as you mentioned, patchy port wine stain on the surface of the skin, and then a mixed lymphovenous malformation underneath the skin, often associated with expansion or out of proportion girth or growth of the affected extremity. So I would say is, yes, this would be suspicious for KTS based upon what you described. An MRI with and without contrast would be necessary to determine the full extent of the depth of the malformation. And that's, again, something that once you get a correct diagnosis, now you can actually start to talk about effective treatments for these type of conditions.
So wouldn't it also be something to consider, since she mentioned patchy, epilepsy, and the size discrepancy, that it could be cutis marmorata, because they can have seizures, they have a discrepancy in that patchy, marbly look. So, I mean, that's something to also explore, right? That it might be cutis marmorata.
Right. And so for the viewers, cutis marmorata is basically superficial lymphatic malformation, a characteristic appearance of the overlying skin. And so, yes, that's also a possibility. Again, both of us are talking about it, but not seeing it. So please share some photos, and either of us, we'd be happy to offer some advice.
Rosalind Herzon says, thank you from California for answering her through the email, her communications with you. She's very thankful. Lots of people jumping on. Nate says, hi, our son Grayson from Lincoln, Nebraska was treated by you 3 different times with an absolutely amazing outcome. He has orbital lymphatic malformation, as well as it affects the right side of his face. His interventional radiologist says his LM, which has remained very stable, may change with puberty. He just turned 12, and I'm wondering if more debulking is likely in his future.
So I will say, first of all, hello. It's good. These are great names that kind of pop up in the back, where your oldies but goodies here. The longer you get stability, the less likely you are to have recurrence. The more you debulk the malformation at an earlier age, and while we don't cure these, the less that remains that has the potential to grow, such that even the small parts that may remain within the structures like the muscles and the skin that we can't necessarily remove, they just never grow back typically like they were when they were young. So I find that regardless as he goes into puberty, I don't expect it to ever be like it was before. And that if it's been stable for many years, time will obviously tell, but hopefully any small recurrences are just that small and easily treated through either a simple interventional injection or sclerotherapy, or a very small revision or surgery through perhaps even the same scars as before. But I would be encouraged that it's been many years since I've heard back from them, and I hope that means that no news is good news. And I'm happy to share photos on every 6 months or a year basis, just for comparison. So that sometimes it's very subtle when things start to change, but hopefully not. And then if there's any question as far as whether or not something is changing, we do, a lot of us are monitored by MRI evaluation. And MRI evaluation is how I would recommend if you're suspicious for any recurrence.
Hi, Cora. Little munchkin. Thank you for that. Very good question from Vita. Vita wants to know, can birth control have an effect on a vascular malformation?
I think that's a magic question. And I would say the answer is yes. And the answer is also no. I mean, I think a lot of people will describe their own personal experience for this. A lot of times, again, we talk about hormonal effects on vascular malformations. And for some people with arteriovenous malformations or venous malformations, thank you, port wine stain. The contraceptive pill can be stabilizing for them. It can prevent the progression. And so sometimes as people, especially young women going into puberty or pregnancy, have experienced progression, sometimes the pill has limited that progression. And at the same time, for a subset of patients, it has not been effective, and perhaps even has perhaps caused things worse, because again, hormones actually affect some of the growth factors that we're still learning about, VEGF2 and how these things affect some of the markers on these malformations. So I'm going to defer to the people like Beth Drolet, people like Dr. Fran Bly, people who probably see a few more of these type of patients and focus on the medical therapy. But again, I think of each of these cases as individualized, and sometimes it's trial and error using safe medications, but really reevaluating them to see how they affect that particular person.
I think that's an excellent way to put it, and I'm glad that you shared that. No two people are alike; they're like snowflakes, and we see that all the time. Where some women will tell us, during their cycle they have pain; others say during their cycle it almost disappears. So I think that's really important that each person, get an assessment. I also encourage females to keep a journal of when they have their symptoms so they can track it with their cycle. And I've had a lot of women write to me and say, since they've been keeping the journal, they're definitely seeing a pattern. So I think that that's been a really good, a good suggestion to just keep a diary when you're symptomatic, when you have pain, or when you see it actually get shrink down or get better, that's just something that they can do. Hi, Cora. A lot of people are listening to your dad and he's helping them. So Lauren Thompson Black says, my daughter has a port wine stain on her cheek. She is almost 3 and has had 15 laser treatments so far. When do you typically recommend going into maintenance? Is it age or the way it looks? Like, when would you recommend that?
Yeah, well, let's talk about the Snowflake Theory. So again, 15 treatments, we would hope to have seen a significant response to that port wine stain, particularly, when we're talking about treating a young child and putting them through these treatments. And I'll say is that sometimes you need to change the settings, and sometimes, even doctor to doctor, not all of us treat them at the same way. But I think in this case, I would certainly be interested in seeing photos of the current stain and then comparing those photos to how she started and maybe some of the progress that she's made. Maintenance therapy is when you feel that the last treatment or two has not made a dramatic change, which means we've kind of hit a plateau. And what I tell people is take time off, take 3 months, take 6 months. The pathology of the port wine stain, there's actually a recycling of the vessels such that after 3 to 6 months, some of those vessels have recycled with their endothelial cells that it becomes responsive again. So you can take off 3 months, 6 months, or even a year. And if you start to see darkening again, that's again the indication to go back into treatment. And perhaps you want to change the settings that you used from last time, whether it be a larger spot size or a smaller spot size, or a slightly increased power of joules to try to get a more effective result.
Quite an interesting phenomenon that Dr. Nelson has been experiencing, especially with the patients missing almost a year of laser treatments where they might have been 50% clear and then they recanalized. And he was saying, well, for each one you missed, the next one, you'll have to, so if you miss 3, at the end of 3, you'll be back. Well, when he started back with the treatments, he saw a dramatic result after the first one following the break.
Yep. That's
and
exactly.
I said, you got to track that and you got to record that, because maybe we say after a period of time, take a break, let it recanalize a little, and then let the laser find the stain again.
Well, not just that, but I think again, the cells that line the vessels have, they replenish themselves, they recycle them. They're not the same vessel as cells that you're treating that may be resistant. And I think it's exciting. I think all of us saw that in the post-COVID world, that we were getting, excellent results again. Perhaps we forgot, just how great this laser is. But in fact, what you're talking about is they took a break and the cells recycled and they were more responsive. That's great.
We're getting ready to do a post. We did the original, which you were our medical editor on our COVID study. We're now getting ready to do one on assessing the impact on those who had COVID and those who had the vaccinations. So it'll be interesting to see if there's been any noted symptoms to the birthmark from those who had COVID and then to those who had the vaccine. So we'll have to see, we're getting ready to launch that soon. So Rosalind says her son is 2 years old with a port wine on his head, left side of face, neck, and almost 70% of his body. Is it normal to have fever overnight after treatments? He undergoes general anesthesia. The treatments, meaning his laser, lasts an hour and 30 minutes. And he has been experiencing 2 fevers following 2 different treatments.
So first, God bless the doctor that's taking care of him, because if you're talking about treating 70% of the body, you're talking about literally hundreds, if not thousands, of spots and due diligence and and attention to detail for the benefit of this child. So that's for number one. Congratulations for finding a great doctor to treat that child. And then the second thing is, this is probably an hour and a half long procedure, I think you described. Well, what happens when you go under anesthesia is the lungs are being affected by the ventilators, but they actually go to sleep and they collapse a little bit. And so sometimes not getting a good full breath in the first couple hours afterwards can have little pockets of the villi or the lungs collapse. It's not uncommon for my patients who have general anesthesia to have a low-grade fever of 100 up to even 101 for the first 24 to 48 hours. And what I tell people is practice taking 10 deep breaths, make a game out of it or whatever you need to do for a child every hour after surgery for the next 24 hours. And if you do it 5 times a day or 10 times a day, that's plenty. But you want 10 big breaths that really expand the lungs to kind of prevent that risk from happening. And I think this is just something that you should watch very closely. And if you associate it with general anesthesia, perhaps that breathing exercise could potentially eliminate that.
That's really good, really, really good and important information. Thank you. So we're wrapping up. We still have a few more minutes, but we've got a lot of questions coming in. So Tara says, I have had my vermilion reduced with a surgery several years ago, and I'm in need of it again. I had it's been recommended that I have a wedge resection but will it leave a scar? Would you agree? And again, she's gonna have to send you picture. So Dr. Levitin's email is in the string here. He'll need to look at the picture, but you know, if you want to discuss it. So she's already had one.
So when she says vermilion, she's really talking about her lips, you know, and this probably is a type of malformation that has caused some enlargement. The enlargement of the lips is very challenging because it happens in 3 vectors. Three vectors. It can make the lip taller, thicker, and wider. And it's very hard to fix all 3 vectors at the same time. And in this case, if she's talking about a wedge excision, she's talking about a lip that's a little bit too wide or too long. And that may be the only way to shorten the lip and make it appropriately sized to compare to the other lip in that sense. And yes, a photo would tell a whole story and be able to help me advise her on whether or not where that should be. But the other, you know, challenge is, where do you place that scar if you need to make a wedge excision? And traditionally, we thought about midline, you know, parts. You know, midlines tend to be scars that hide well, but I find that actually far off to one side or the other can be equally, if not more, effective. So it really, again, it depends upon where the malformation has caused the greatest problem. And again, I'm happy to share, you know, any free advice just based on pictures that she can send me.
Thank you. We're getting down to 7 minutes. Nina has a question. Her son is also on sirolimus for KHE, a Kaposi form of hemangioma endothelioma, as well as Kasabek-Merritt phenomenon. He's 8 months old. We also take Bactrim 3 times a week to prevent pneumonia. How often are you seeing these cases? We are treated in Cincinnati. I mean, you know, I see everything, and I would say I see KHE cases maybe once or twice a year, if that, right? Very rare.
Yeah, KHE is actually, you know, one of those rare types of vascular tumors that, you know, we see very infrequently, fortunately, but they're a platelet trapping, condition that we have to treat very aggressively early on. I think this is, one of those times where there's no great treatment for these. You know, we try to avoid, consider all treatment options are on the table, whether it be medical therapy or surgical therapy. And so it sounds like this has, again, someone's treating them at Cincinnati Children's Hospital and is very much involved. I don't want to offer any specific advice, because it sounds like they have a treating physician that, should be really the one in charge. If they have any other questions offline, I'm happy to answer them.
Okay, and yeah, because send a picture, because there does come a point a lot of times with these cases where surgery does play a role, and then that kind of mitigates, the years that they can be on drug therapy.
Correct. Debulking these lesions can be actually removing 80 or 90% of the offending portion of the malformation, or in this case, tumor. So yes, I mean, like I said, I am a surgeon, but I also value medical therapy. And like I said, I'm happy to evaluate the whole context of this case if they can share some more details.
Thank you. So Mary Davis has a good question. Do lymphatic malformations have defined walled off pockets of fluid? And does that fluid, and I think she means the lymph fluid, leak into other tissue? Our 1-year-old daughter has what looks like a multifocal cyst in subcutaneous tissue in her abdomen. Local ped surgeon diagnosed lymphatic malformation and recommends removal, but I am uncertain.
Sure. So first I'll say lymphatic malformations are actually composed of the same lymphatic vessel tissue that is in our normal lymphatic system. So it's an aberration or an abnormal composition or collection of lymphatic vessels in a malformation setting, but really an MRI will determine the exact location in the abdomen. Is this contained in the skin and the fat? Is it penetrate through the muscle? Is there anything, that actually goes into the abdominal cavity or anything like that? Those are the kinds of, important details that would define the extent of the malformation and also how reasonable or likely it is to treat it effectively with surgery. If they can share some clinical photos and or the MRI report or even the images, I'm happy to evaluate them and help them see this and see what might be an appropriate treatment. I'll just say, as someone who specializes in vascular birthmarks, by training, I'm a head, neck, or ear, nose, and throat doctor. But I also treat all extremities. I treat arms, legs, and abdomens because malformations occur all over the body. And sometimes it's very hard to find a specialist for a birthmark that it doesn't occur in a specialized area. So I encourage everyone to keep looking. And again, I'm happy to help them, treat them, or whatever it may take to get the most accurate diagnosis and the appropriate treatment plan.
And that's a great segue, because the next patient, and again, many of you, I would recommend trying to come to our conference at birthmark.org/conference. You bring your records, any photos, any imaging studies, get a free consultation, and you'll leave with an accurate diagnosis and a treatment plan. Whether you have it with our doctors or not, you'll know what you need to get the best outcome for yourself or your child. So as we wrap up, Nikisha is from the Barbados, and she has a 9-year-old daughter who was treated in New York. She has a lymphatic malformation on her right leg from her buttock to her ankle. She's saying she's getting what looks like little water blisters, which we call those the frog's eggs, whatever. And she wants to know, is there anything else that can happen or help her at this time? And that's why I was saying she's a perfect person to come to the conference, and have everyone see.
I hope she does. I mean, yeah, so this is a superficial component of lymphatic malformation, which is actually some of the more challenging areas to treat because we don't have a good laser. We don't have a good medical therapy for these type of things. What we sometimes need to do is consider a type of treatment, which I call coblation. Coblation is a type of radio frequency device that can actually ablate just a very superficial component to this. It requires dressing changes for about 2 weeks, but the healing skin is actually a nice, tough, firm layer of scarred epithelium, which can actually prevent the regrowth of some of these lymphatic vessels. And it may take more than one treatment, but it has been successful in some of these patients, especially the ones who have, I say, leaky, skin, where these vessels are either just from normal daily activities break open. They often have to wear, padding or gauzes to collect this. And it obviously greatly affects their quality of life because, they, every time they go out, they have to be worried if they're going to have leaking lymphatic fluid in their clothes. So again, a picture would tell me a lot of information, but also, being in front of 14 experts would be also a great help for her as well. So hopefully, after we've gotten through the summer, we should all be able to travel safely, and I hope she can come up and see us.
So for our last question, and by the way, any that have not been answered, we did get through almost every single one of them, and more may come in the next few seconds. You can feel free to email Dr. Levitin or myself.
Sure.
And or come to our conference and see him in person at a free consultation. But the last question comes from Tatiana Chala. She is from Texas. Her daughter had a cheek hemangioma, both surface and inside. It started shrinking, and now at the age of 4.5 years old, so 4.5, it's half the size. We started the propranolol treatment 2 months ago, and there is a difference, but not a significant one. When would you recommend to start laser or other kind of treatments?
So this is a 4.5-year-old child, not a 4.5-month-old, correct?
Yeah, she says 4.5 years old.
Yeah, years old. Okay, I just want to make sure I heard that correctly. So typically, those of us who treat medical therapy for hemangiomas, we typically do not treat past 18 months of age, and in fact, primarily treat under 12 months of age because the proliferating or growing phase of the hemangioma is when it's most responsive to propranolol. And so I tell people treating longer is not better. I don't see benefits after 12 to 18 months, certainly not after 2 or 3 years of age. And she describes slight benefit, which maybe or may not be true, but it certainly wasn't dramatically different. And so I don't think it's justified to put a child on the medication at this age if you're not seeing a dramatic change and not likely to change the outcome. Now, the outcome is we want a normal appearance. A child with a cheek hemangioma, we know what the other side is supposed to look like. And so a combination of laser or surgery can be very effective in bringing this to normal appearance. And we certainly at age 4.5 the child is already developing awareness of what the other, that there's something different about their cheek. And so I would highly encourage them to share some emails with me, and I'm happy to give them my advice if laser or surgery would be an option. But I would also encourage them to make 2021 the year to get this treated. This child's going to be going to school in a year, and they've already, are playing with friends that can see what's, very visible to them, and it's very treatable. There's no reason why we have to, postpone any further treatment.
Well, Dr. Levitin, it's been amazing and enlightening, and there are several other questions which I know you will answer offline, especially when to start laser for a hemangioma. Do you do it while they are on propranolol? Do you yourself laser while they are on a beta blocker, or do you wait, or?
You gotta give me 1
There's a
minute.
couple.
I gotta answer that one. The answer is yes, yes, and yes. We treat laser as early as possible, and it's actually even highly effective while on propranolol. Perhaps the study did show that you do less propranolol and less laser when you combine them together during that first year of life. So
That's awesome.
yeah, so I would that's a great question, and it needed to be talked about today. So thank you for bringing
Yeah, and it was the last two questions that came in were the
Sure.
same, so I said I got to get that in. But it's been fabulous as usual. You are one of our most popular doctors. The questions never stop. At any given moment, we had 45 people on that were anxious to say hello or to ask you a question. So we thank you for the time that you donate out of your own time in your home with your family, to participate in these VBF Facebook Lives, and to also always offer to answer anyone's questions free, and as a courtesy to the families and as part of the relationship you have with us. So we're just really grateful to have you, and thank you. And we will see you in October at the conference. So have a nice summer. And I know we'll be talking to you before that to catch up, but thank you for this session. It's been very great for our families.
Thank you, Dr. Linda, and also thank you to everyone for getting on. I know it's a business day for everyone, but these were great questions, and I know that this lives on forever online. But these are great questions, not just for the patients who are the people who logged on, but for patients who may view this later.
And remember, we have them back to 2017 with Dr. Levitin, and you can go back and view any of them, including this one, over and over again on YouTube. Just go to birthmark.org and click on our YouTube icon, and you can see them all and watch them all. Thank you all. Have a great day. Stay safe, stay well. God bless.
Thank you.